Welcome to NSG 227, Study Session 10, Administration of an Intravenous Infusion. Introduction. Fluids are administered intravenously in hospitals, outpatient diagnostic and surgical settings, clinics, to replace fluids, administer medications, and provide nutrients when no other route of administration is available. The choice of an IV solution depends on the purpose of its administration. This teaching session discusses intravenous infusions, the types, the purpose, articles needed, and technique of the procedure. Learning outcomes. When you have studied this session, you should be able to 1. Define intravenous infusion. 2. State the purpose for administering intravenous infusion. 3. State the types of intravenous fluids. 4. State the articles needed for the procedure. 5. State the technique of the procedure. 6. State the factors that influence flow rate. 7. Identify the complications of intravenous therapy. Defining intravenous infusion. This is the administration of fluid into the bloodstream through an intravenous catheter or butterfly needle inserted into a peripheral vein to replace fluid losses, supply caloric intake, or as carrying solution for medications. Purpose of administering intravenous infusion. These are 1. To administer fluid and electrolytes to maintain the balance within the body. 2. To provide glucose necessary for metabolism. 3. To provide water-soluble vitamins and minerals. 4. To establish a lifeline in case of emergency. 5. To administer medications. 6. To administer blood and blood products. Types of intravenous fluids. Solutions are often categorized as isotonic, hypotonic, or hypertonic, according to whether their total osmolality is the same as, less than, or greater than that of blood, respectively. A solution's osmolality is essential in administration of intravenous fluids. The osmolality of plasma in approximately 300 mOSM liters, 300 mmol liters. For example, a 10% dextrose solution has an osmolality of approximately 505 mOSM liters. Isotonic fluids. Fluids that are classified as isotonic have a total osmolality close to that of extracellular fluid and do not cause red blood cells to shrink or swell. Electrolyte solutions are considered isotonic if the total electrolyte content, anionizations, is approximately 310 MEq liters. The composition of these fluids may or may not approximate that of the ECF. Examples include 1. D5W, 5% dextrose. It has a serum osmolality of 252 mOSM liters. Once administered, the glucose is rapidly metabolized, and this initially isotonic solution then disperses as a hypotonic fluid, 1/3 extracellular and 2/3 intracellular. Indication: patient is at risk for increased intracranial pressure. Uses: to supply water and to correct an increased serum osmolality. Contraindications: fluid resuscitation because hyperglycemia can result. 2. Normal saline solution. normal saline 0.9% sodium chloride solution has a total osmolality of 308 mOSM liters. Because the osmolality is entirely contributed by electrolytes, the solution remains within the ECF. It contains only sodium and chloride and is not identical to ECF. Uses: administration of blood transfusions to replace large sodium losses such as in burn injuries. 3. Lactated Ringer's solution. It contains potassium and calcium in addition to sodium chloride. Uses: to correct dehydration and sodium depletion and replace GI losses. Hypotonic fluids. The total electrolyte content is less than 250 MEq liters. Purpose: to replace cellular fluid because it is hypotonic compared with plasma. To provide free water for excretion of body waste. Indications: hypernatremia and other hyperosmolar conditions. Example: half-strength saline 0.45% sodium chloride solution with an osmolality of 154 mOSM liter is frequently used. Articles required. A clean tray containing 1. Infusion set, 2. IV fluid, 3. Adhesive tape, 4. Clean gloves, 5. Tourniquet, 6. Antiseptic swab, 7. Antiseptic ointment, optional, 8. IV cannula and yolk cut, butterfly needle, 9. Sterile gauze dressing or transparent occlusive dressing, 10. Arm splint, optional, 11. Towel or pad, 12. Macintosh or waterproof pad, 13. Kidney tray. B. Other articles. 1. IV pole, 2. Electronic infusion pump, optional. Study session summary. In this study session, you have learnt that fluids are administered intravenously in hospitals, outpatient diagnostic and surgical settings, clinics to replace fluids, administer medications, and provide nutrients when no other route of administration is available. The choice of an IV solution depends on the purpose of its administration. In this teaching, you have learnt the types, the purpose, articles needed, and technique of the procedure. End of study session 10. Thanks for listening.